The risk to children from coronavirus is a fraction of the risk from flu every single year. No one ever talked about closing schools for that. People say, okay, children may not get seriously ill from this virus, but they might pass it on to their families. Really? In one study, quote, "We have not found a single instance of a child infecting parents." They lecture us about contact tracing. Well, they did it for a boy with coronavirus. He came into contact with 172 classmates and teachers while symptomatic and didn't transmit the disease to any of them, not one out of 172 people. In Switzerland, the country's head of infectious disease says, scientists, quote, now know young children don't transmit the virus. Because of all this, countless other countries, starting with Denmark, had already begun reopening schools before the summer break. When the president pointed that out this week, the idiot said, but we have thousands of new cases a day and Denmark doesn't. But Denmark reopened schools months ago. If you equalize for population size and testing rates, there's nothing like the difference in case numbers between the US now and Denmark then. And the data shows that reopening schools didn't worsen their outbreak at all. And yet here in America, summer camps are closed and school plans are in doubt. This is not safe. It's harming our children. Almost a third of parents say their children's emotional or mental health is suffering. Another third worry that it'll start hurting their children soon. It's hurting their education and their future prospects too. The evidence is piling up that remote learning doesn't work, especially for the poorest families and those in rural areas with unreliable internet. And perhaps worst of all, we're seeing reports of a rise in child abuse. Beyond the impact on children, there's the impact on our economy. If kids can't go to school, parents can't go to work. Here's a farmer from Minnesota this week.
The really big question mark right now is whether there'll be school here this fall, because the harvest season, almost more than planting, is all hands on deck. That would be really, really difficult to manage both kids with no childcare.
And by the way, schools open 1 day a week or 3 days a week or in the morning or the afternoon or whatever other pseudo-scientific bureaucratic claptrap they come up with. It's still a disaster. Responding to New York's 1 to 3 day a week plan, the leading employers group was crystal clear. People will not be able to go back to work. Australia gets all this. Its deputy chief medical officer said the evidence does not support avoiding classroom learning as a means to control COVID. In Canada, they get all this. Experts at a Toronto Children's Hospital called for opening schools with no restrictions. Masks, they say, if worn incorrectly, it could lead to increased risk of infection, and it's not practical for a child to wear a mask properly for the duration of a school day. Strict physical distancing, they say, should not be emphasized to children in the school setting as it is not practical and could cause significant psychological harm. In line with all those medical experts, President Trump gets all this.
We're very much going to put pressure on governors and everybody else to open the schools, to get them open. And it's very important. It's very important for our country. It's very important for the well-being of the student and the parents.
But with all this damage, all this pain, and all this scientific evidence, still there isn't a clear back-to-school instruction from the CDC, from the people we're told to trust. Still, they witter on about an abundance of caution and risk aversion. Still, they trot out their weasel words to cover their you-know-what. Here's Dr. Fauci this week.
The broad approach would be, obviously, but paying attention to the safety of the children, which is always paramount, but within the context of doing whatever you can to safeguard the health and the welfare of the children, we should try to get the schools open.
In Denmark, they're definitive. In Australia, in Canada, in England, in Switzerland, in Iceland, for goodness sake. Why is our own CDC, preposterously praised by the media as the best public health agency in the world, still hemming and hawing on these vital questions when other countries have done the research and published clear conclusions? What have you been doing, Dr. Redfield? You've had January, February, March, April, May, June. No wonder the president is forcing the pace. Of course he's right to use the leverage of federal money, but frankly, that is a small proportion. And by the way, rightly so. We believe in decentralization on this show, and we believe above all in people power. It's time to use it over this school's fiasco. If your child's school won't open this fall, demand your money back so you can find an alternative. It's your child, it's your tax dollars. Why should you pay for a service you're not getting? That's our new campaign. Reopen schools or give me my school money back. Take it to the courts.